all those things. But if you haven't worked on their trauma first and gotten them in a place to where they can even hear that, it doesn't work. And so do you kind of want to explain?
Yeah. So I think what's helpful for people to know, as Elena was saying, is kind of what makes us different. And then I'd like to share just a little bit of our outcomes, because I think that really speaks to the work we're doing.
Absolutely.
Again, what makes us different is we are program first, housing second, but even within that, the person comes before the program. And so what we mean by that is every single person is individualized for them. What we tend to do in our society is we label, right? Homelessness, foster care, sex trafficking, addiction. And what's interesting is when you get down to an individual who's been through foster care and they're home and they become homeless, they can experience all of those things, right? So now instead of putting a label and just fixing this one thing, we're actually trying to see people as a whole person and saying, what does this individual need outside of what even the program offers to meet them in their uniqueness and their wholeness? And so that's something we really, really do. There's times that for the trauma-informed part of it, we will do things because that one individual needs it, and it's not something we do for everybody else. We really want to meet people where they're at. We, as Elena said, we work on calming the nervous system. We work on creating new neural pathways, which means we're showing individuals their competencies and strengths. A lot of what happens in trauma and in our society is we label things as good and bad, right and wrong. Your behavior is bad, your behavior is not correct. And when you're really doing trauma work, you're saying your body and brain is responding exactly how it's supposed to be. Now, my job as the coach, or Elena's job as the coach, is to be non-reactive to how they're responding and to stay calm and allow them to regulate so that we're not doing work in a dysregulated state. It's really important for our health to not be dysregulated. There's a lot of studies linked with autoimmune diseases, with different comorbidities that actually go back to trauma. And we're seeing that with our kids. A lot of our kids get diagnosed with different comorbidities. We calm their nervous system. We get them to a certain place. They test completely different. Some of our current outcomes, every youth that comes in, the day one that they come in, we do a generalized anxiety disorder quiz. Every single one of them scores severe anxiety. Mm-hmm. We're not against outside professional, psychiatry or medication, but we actually work on calming nervous system first, unless we believe they're an endangerment to themselves or others. Every single one of our youth within 1 to 3 months, max 6 months, all score mild to normal on their GAD score with no medication. And that's all from calming their nervous system. So kids that lived with anxiety their whole lives are no longer feeling anxiety, and they're functioning completely different. All of our kids within 1 month to 6 months at the max are off all substances. So you're not allowed to use anything that would numb here, and outside drugs, recreational. And kids that have had a drug problem their whole lives, they come in and they stay clean. And part of that's just giving them, again, the tools to get out, to empower. That's a big thing we do here, is we empower. It's not helpful if they think we're the reason they're getting better. So how do we create sustainable tools that don't cost anything when they leave here, or cost very little? So accessible tools to have the change in their life continuously, despite being at Foster 360.
I love what you said about empowerment. And that's where we are so